All right. Hello, everyone, and welcome to the first installment of our provider experience interview here. We have Dr. Randy Jenkins here, and we're going to go ahead and start with who you are and your role in kidney care, or what it was, rather.
Yeah. Well, let's see. I'm Randy Jenkins. I'm pediatric nephrologist. If I'm not mistaken, I'm like the 300th or something, uh, the first 300 of everybody in the country who is pediatric nephrologist. So I know that because my board certification, I think I'm number 308. And so I was board certified in 85. Did my fellowship training in Oregon, um, 83 to 85. And then I've worked at a number of places over the years, but I'm actually semi retired now. So I
All right.
worked for about 40 years and then decided to partially hang it up. So I'm still doing a little kind of part time work in Boise, Idaho. But probably within a year or so, I'm going to probably just enjoy retirement. So,
Yeah, that
yeah.
sounds like a plan. Um, Just so everybody knows, so there's no confusion, Dr. Jenkins was my pediatric nephrologist for 21 years, from the time I was born to the time I aged out. And so I'm sure that doesn't make you feel any sort of way. But what drew
21 years
you
is nothing.
out of 40, right? So
Yeah.
what drew you to working with kidney patients specifically?
You know, the way it sort of works is when a person first trains in medical school, at that point they sort of figure out, do they want to deal with children or adults or actually things like um, ophthalmology, eyes. You have to figure out that one early, apparently, to get in. But the basic thing is whether you can do kids or adults. And so that's what you have to figure out in medical school. And I figured out that I'd rather deal with kids than adults because I believe it was my time in the Veterans VA hospital that kind of thought to myself, I don't want to do this. Um, and I enjoyed seeing the children a lot better. Anyhow, so, and then, when you're training, um, and you also have to decide, are you going to do the surgical part or the medical part? So, and they're very different. So, medical is somebody who works with their hands a lot. You have to be really good at hand dexterity. Um, and so that's what surgeons do. Although the orthopedics, they just have hammers and chisels and stuff. But um, whereas the medical people kind of deal more with medical problems and how to solve problems with figuring things out and lab tests and giving medications to fix problems. So it's kind of a different perspective. You need both, but they're very different. And so, kind of rapidly, people sort out like what their, what, what works better for them. The people who are really good at uh, manual tasks tend to gravitate towards surgery, and the people who are a little bit more like the mental tasks tend to go towards the medical. And that's kind of how it tends to shake out. And I sort of shook out towards the medical end. And and then, like I said, the children's end. And so when you do your after medical school, you do your residency, whether it's a surgical one, a medical one, kids or adults. I think all the surgeons have to start out in the surgical thing, but in the medical, you either go kids or adults. You got to decide that early, unless you want to do both, and then you go family practice.
Mhm.
but you got to do an extra year to do that.
Okay.
Anyhow, um, and to some degree, it gets a little bit influenced by who you're around in medical school and who inspires you and who doesn't, that kind of thing. So, um, yeah, so that kind of helps you decide which way you're going to go. And and then as I did my pediatric residency in your second year, you kind of you basically try out 4 to 6 weeks of every different specialty there is, and you see which one floats your boat.
Hmm.
And they're kind of different, So for me, I enjoyed nephrology. Was It's a lot of like detective work.
Hmm.
You have to you have to look at a situation and figure it out and make a plan. And because they don't all come like with all tied up in a bow.
Right.
So to some degree, a surgeon has to do that too. Um, but for the medical thing, it's basically detective work. Now, if you're a heart doctor, you only pretty much have your listen to the heart, EKG, and echo, and that's about it. And a lung doctor pretty much has your stethoscope and chest X-ray.
Hmm.
And but nephrology is kind of way more complicated. You got to look at a lot of different things, and I sort of enjoyed that challenge of figuring stuff out. So, for example, I was just in Boise last week, and I got presented with somebody who showed up in kidney failure, and I had to figure out what's wrong with you and how to get them better.
Hmm.
And you don't have a whole lot of time because some of the conditions can do a kidney in real fast.
Hmm.
And so that's kind of interesting. And I still enjoy that challenge of figuring something out, even if you figure out something that's 1 in a million or 1 in 10 million, which is kind of what last week's adventure was about. And I still get kind of I like that challenge, figuring that out. And you sort of learn the tools in your training how to figure out things, even if they're rare, and get people better. So, um, so I think as I did my nephrology rotation in in Oregon, I really enjoyed the challenge presented in nephrology, and that kind of attracted me, and so I signed up to train that way.
Hmm.
So that's kind of how everybody kind of goes through that process and figures out what works for them. So
Yeah. Well, thank you for choosing that. It, it sounds like you really enjoy what you do. I mean, to do it for 40 years, right? So, I mean, I'm happy that you found what you enjoyed.
yeah,
Um, what do you think, from your perspective, is one of the hardest parts of living with kidney disease?
as a patient,
Yeah, really, like what do you see from your perspective as being the hardest part?
hardest part. That kind of differs for different people.
Mm.
For some people, the hardest part is having to take medicine every day. But the truth is, almost everybody has to take medicine every day
Right.
for, something or other.
Hmm.
You know, people don't realize it when they're young. They think, well, I'm the only one. No, you're really not.
Right.
There's a ton of people have to take something every day.
Hmm.
But um, I think um, so that's one thing that kind of discourages people to think they got to do something like that every day. And then um, I think another hard part is that for some people, depending on what you're dealing with, um, it can be a rough life. Like if you're doing dialysis a lot,
Mhm.
And some people have to do it all their life. They don't get the opportunity of a transplant for various reasons. Um, it's kind of hard to, you know, tell somebody that they're going to have to deal with that. It would be hard to, if you were stuck on dialysis forever, for example, it'd be hard to tell somebody that. Thankfully, most people can get a transplant, but not everybody can.
Mhm.
So I think I think the hardest is when you have some condition that you really can't help, or you
Mhm.
can't fix, or can't make away, or can't do anything to give somebody a reasonable life.
Yeah.
That can be that it's just hard emotionally for everybody.
Yeah. Yeah. Definitely. I don't know anybody that there isn't anybody that I know that's had to go through that, but I do know of one other person that we're going to be interviewing later that's had like three kidney transplants and been on dialysis for a long time, and and I can't even imagine having
Yeah.
to go through that. And yeah, I think you're right. There's definitely some people out there that live with tougher conditions and other people that don't that just don't, and I know I have it kind of in the middle. I feel like, where as far as conditions go, I'm kind of in the I'm not too hard, but I don't have it super easy either. You know what I
Yeah.
mean?
No, that's true.
So
That's fair to say. Yeah.
yeah. Um
The other thing that's frustrating is that we deal with a lot of people that you kind of could know kind of advance that they're probably not going to take their medicines, and they're probably
mm,
going to have all kinds of havoc. And I don't think people sort of understand that. I try to tell people this early on. When you have serious kidney condition, you can take the easy way, you can take the hard way.
yep.
Now, maybe I shouldn't call it the easy way, but the easier way.
Right.
But the problem is for a lot of people, it's kind of frustrating to me to see a lot of people that'll just stop taking their medicines, and they'll get by for a couple days or a couple weeks. And then when it finally turns out to be too late, um, and maybe they reject their transplant or something, life goes from being pretty good to pretty bad.
Yeah.
And they can have a lot of hell for the next few years. And it's hard to impart on people, like, you don't want to do that.
Hmm.
Like, and, but despite saying that, there'll always be people that are going to go that route. They're going to
Hmm.
not take their medicines. They're going to lose their transplant.
Hmm.
They're going to have complications, and they might just die.
Right.
And, or they're just going to make their life kind of hell. And it just feels like that doesn't need to be. But it's hard to impart that. And sometimes it's helpful to have not just me say it, but hear it from people like you who've been through
Hmm.
some of this stuff to say, hey, buddy, you don't want to go that route.
Yeah.
It's,
Yeah, for sure.
because it's irreversible when you start down that path. You're stuck on that path, and
Hmm.
it's sad for me to see when people lose their lives that they didn't have to.
Hmm.
I guess that's true with everything in life, but it's particularly true here. And you can you need to, like, try to get it across and be genuine, and
Hmm.
don't act like you're trying to force somebody to do something that they don't want to do, but
Right.
you just want them to have their eyes open.
Well, yeah, I would imagine as a provider too, you care about your patients and you don't want to see them do that
Yeah,
to themselves, right? And so
yeah,
and to my understanding too, I mean, when I I remember I feel like I'm a good patient, but I wasn't always the best. And as you know, I mean, there was a time when I decided, oh, I'm not gonna, you know, catheterize, and I think my mom came in and told you, and was like, "Hey, Dr. Jenkins, this is what's going on," and you sat me down and said, "Hey, man, there is this way where you don't do what you're supposed to do and you lose your transplant, or there's this way where we do what we're supposed to do,
Yeah,
and it may not be the easiest way, but it is the easier way to do things, and you keep the
yeah,
transplant and you don't go on dialysis."
yeah,
And I think it's important, especially when you're dealing with teens and young adults that don't have the highest compliance rating.
no,
And I think it's important for them to understand that there are, um, consequences to their actions, right?
yeah,
So to
that's right.
speak. Yeah.
Yeah.
Why do you, speaking of that, why do you think teens and young adults have such a low compliance rate?
Well, I think there's just a tendency to, when you're young, when you're young and smart, you kind of think you know everything. Um, and you don't.
Right.
Um, so, plus, it's just nobody really wants to face the possibility of bad trouble. And
Mhm.
you kind of, a lot of people sort of trust the way they feel. So, if they feel good, they kind of get lulled into thinking, well, this is okay. I didn't take my medicines for a few days and I still feel great.
Yeah.
So, there's nothing to warn you before it's kind of too late.
Right.
And I just think that it comes with maturity, and maturity happens at different ages. It can happen in mid teens, and sometimes it doesn't ever happen. There's a wide range of maturity, and I think being able to take your medicines, and it's just part of maturing. And unfortunately, some parents let their kids who are 12 or 13 make decisions about taking their medicines. I mean, I got somebody I'm sort of struggling with right now who's a young teenager, and she doesn't want to take her medicine, and she's on a particular medicine. If she doesn't take it, she will she'll have to go on dialysis and need a transplant, or it doesn't have to happen.
Mhm.
And but you can't. The mother was letting the teen sort of decide when to take her medicine, and she's 13. 13-year-olds aren't mature enough to decide that. And
Mhm.
a lot of 16 or 17-year-olds aren't either.
Mhm.
And where you turn that corner and realize that your life is really in your own hands, and
Mhm.
you got to take care of yourself. Like, it's time for you to be the boss, and you to kind of accept, this is what I got to do. That doesn't happen at the same age at all. It's very different, and to some degree, um, I've seen too many parents that coddle their kids,
Mhm.
and they don't let their kids like develop maturity.
Mhm.
Um, they a kid needs to kind of be your own person and learn how to do stuff, and that's a tricky thing, to try to give them their responsibility, but not so much that you do yourself in.
Mhm.
It's not an easy thing to pass on that responsibility. It's not something you're born with. You don't get it at an exact age, and it's very different from person to person, where they finally decide, I'm going to take care of myself. I mean, honestly, some people never figure it out,
Yeah.
whether they have serious problems or no problems.
Mhm.
To some degree, people who have serious medical problems do have to figure it out earlier,
Mhm.
but it's a quite a variable thing when people take responsibility for their own self. And I've seen it. everything all over the place
Hmm.
over the years as to when you take responsibility. And unfortunately, can't always count on your parents. I
Hmm.
mean, most people, their parents have they certainly have the right intention most of the time.
Hmm.
Um, but sometimes they don't always have the right idea, or they don't give their kid enough room to figure it out themselves. That's a that's a that's a tough thing, and there's no cookbook for that.
No, for sure. Yeah. Yeah. I was lucky enough, to have good parents and a mom that listened to you when you said, "Hey, it's time to start teaching him now to, catheterize himself
Yeah,
and to take his meds and learn what meds are what and
yeah,
what they're for." And I remember my very first kidney camp that I went to. Of course, I got a UTI, which is pretty textbook for me, as you know, unfortunately. And I
remember
remember
that.
going with the camp nurse to the urgent care down there, and they were like, "All right, what do you?" And she had forgotten my paperwork at the camp, and she was like, "Oh my goodness, I'm gonna have to go back and get this." And I said, "I know all my meds." She was like, "You do?" I said, "I know the milligram. I know what I take it for. I know the names." And she was
That's
like,
good for you.
she said, "That's impressive." She said,
Yeah,
"There's not very many teens out there that know their meds and what
yeah,
they take it for."
yeah,
So you're right. Maturity comes, in time for different people at different ages. And
yeah,
I was definitely one of the ones that came early, but
yeah.
not everyone's like that. I know one of my friends
Yeah,
who had his second transplant recently. He absolutely his maturity did not come until later, where he was like, "Oh,
yeah,
I really got to take care of myself." It didn't come till after
yeah,
after me. So, but yeah. Um, let's look at some communication and some trust here between patients and providers. What does good communication between patients and providers look like to you?
um, well, honesty for starters,
Hmm.
and then you know, these days that there's lots of ways of communication. So, I
Hmm.
mean, for example, it used to be just calling the office and leaving a message or something, but now, we have this thing called My Chart that
Hmm.
now is available for, honestly, most transplant centers have that. Most major universities have that kind of thing where you can send a note anytime, any day
Yeah.
to the provider, and they might not going to see it in the middle of the night. If you need something right away, you got to call. But I think it sort of means like it just means communicating, like asking questions, telling people, "Hey, this is what's going on,"
Mhm.
and sending messages. And honestly, the systems they have today, they work pretty good to allow people to do that, whether it's parents or the kids themselves, sending message back and forth to the provider. That's kind of proactive instead of waiting until things go to go to pot,
Right.
so to speak.
Yeah. I think it's important to let your providers know when you're struggling too. Like
Yeah,
like struggling whether it's to take your meds or
yeah,
struggling to do what you got to do. I think it's important to let them know that because your your providers are normally pretty well connected with the people that you need to see to
yeah.
be able to, help you out. And so,
And there's things you can do, like this journey, a few medicines you're on that you could probably get by without for a while.
mhm,
And sometimes when you're struggling, it's best to simplify, get down to the basics, what you really got to have and what's really important. And
mhm,
some of the stuff that's kind of foo foo, like put it aside
Yeah.
right away because you know see, there are things that are more important than others
Right.
times, and the most crucial things are don't lose your transplant
Mm-hmm.
and don't if your kidneys are failing, don't let things get into life-threatening situations like a
Right.
high potassium level or something like that.
Right. Yeah. Like if you have a transplant, we might not be able to take you off your tacrolimus or your cyclosporin, but maybe we can do away with something else, like I don't know, a
And your
vitamin,
vitamin D
your
or
vitamin D. Yeah, I was just gonna say that, like your vitamin D or something like that to that effect. Um, yeah, yeah, it's definitely important to, if people are feeling like maybe it's too much too to talk to their provider, because you never know what they might do. They might just say, "Hey, yeah, maybe it is too much. Maybe we need to back off for a little bit on something."
yeah,
Yeah. Yeah, you never know until you ask.
yeah.
I think that's important. Um, what's something that you've learned from patients that's changed how you practice?
Hmm.
That's a big question.
Um, well, I guess it's listening to how they're feeling about things
Mm,
and where their heads at and um how they feel about themselves and how they feel about what's going on. I think that's super important. I mean,
mhm,
it's like when you're a baby, it doesn't much matter. It's what the parents know.
mhm,
But, you know, by the time you're like even 4 or 5 years old, it's important to um it's important to for that person to understand what's going on and to feel good about stuff and not to ignore them. Um, and everybody's different, and so um, to some degree, I mean, I remember just the other day I was talking to somebody in the hospital, and I think she was 14, and her mother was there, and I kind of ignored the mother, and I was just talking to the kid because she actually had um, she had cancer, and
mhm,
um, anyhow, and she had a transplant that we were trying to keep safe during this time.
mhm,
She was going to get through all that cancer thing, but I remember distinctly kind of ignoring the mother and just talking to the teenager.
mhm.
Um, and I remember thinking, yeah, this is what's important. Just like, because once you get that age, it's kind of you're the main person. You're
Mhm.
the one who's got to take the medicine. It's
Yep.
your life, and so yeah, the parent has to be involved, and
Mhm.
but um, but the kid's the main event. That's the person. That's whose life is being affected, and
Mhm.
so I try to focus on not the parent but the patient,
Yeah.
um, even if they're younger.
I remember you asking me a lot of questions, and I feel like it's a balance of knowing when to talk to the patient and knowing when to talk to the parent when it's pediatrics. And
Yeah,
I feel like not a lot of adult side physicians get that,
no, not at
for
all.
the people, like for the patients like me who have been doing this their whole life. Sometimes mom knows a thing or two, you
Yeah,
know, and and
yes,
sometimes mom can answer the question better than even I can, you know.
yeah,
Um, and that's a struggle that I had when I was going through my, as you know, because I reached out to you a lot. I was in the hospital once a month for about 14 months,
A
sometimes twice
long
a month.
time. I remember.
Yeah, when I was when I was aged out, and they just were not interested in talking to mom, which is all fine and good, but sometimes when I'm not feeling well and I can't answer
Yeah.
for myself,
Yeah.
sometimes having mom there is really helpful, right?
Yeah.
Yeah.
Yeah. That's true. That is very true.
Yeah. Um, looking at some more questions here. How can patients feel more confident speaking up or asking questions?
Um, well, I sort of feel like it's my job to make it easy for them to do that.
Mm,
Um, because not everybody, some people are intimidated by the whole thing.
right.
Um, so it's my job to open the door
Mm-hmm.
and say, try to elicit questions and don't just assume it's done. It's like, no, I think it's a provider's job to open that door to keep that communication open,
Mm-hmm.
because if they're not on board with what's going on, it's not going to work.
Yeah. Yeah, for sure. If I don't like what you're doing, then it's gonna make me not want to do it, you know.
Yeah,
And that's something we definitely don't want, right?
but there's
Whereas,
sometimes where there's something you got to do that you're not going to want to do, but you got to do,
right, like
and
dialysis or
that's where talking to both the parent and the kid, and because independent of the age of the person, there's going to be some things that they're just going to have to do and
mm,
suck it up and try to explain why. But because there are a lot of things that if you're young, you don't want to get any immunizations.
mhm,
You know, as I'm going back to this girl I saw about a week ago who had a really bad, serious condition,
mhm,
um, and she needed to have immunizations before she got a particular medicine.
mhm,
And she was 17, but she didn't want to take those
yeah,
shots.
mhm,
Most 17-year-olds don't. And
yeah,
she hadn't had kidney disease before, so this is all new.
mhm,
And you know, so it's kind of my job to explain why she kind of had to have it, and her parents could help out, and
mhm,
because they had to understand too, and kind of help her to see that this kind of wasn't an optional thing.
right,
So, but you got to tailor that for every kid and different ages, and and for example, there's some things that I might actually a younger kid, I might not tell them right away.
mm,
Um, Whereas I might tell the parents because there's some things that are just a little bit too scary
mhm,
to tell a younger kid right away. So
yeah,
um, anyhow, those are kind of tricky things to
yeah.
decide how to handle.
Now,
But in general, I try to be honest with everybody.
yeah,
But um, I might not tell a younger person that, hey, if you eat too much of those high potassium foods, you could die.
right,
And but they kind of feel compelled to tell their parents because somebody's got to know who's in charge of what they're eating.
mhm,
If they're truly at risk like that, like if your kidneys are failed and your potassium level's high, but you kind of have to tailor it a little bit to who's ready to hear what when.
Hmm. Yeah. I know you and I always had a honest communication,
Yeah.
and so I've always been thankful for that, that you felt like you can talk to me and tell
Yeah, I
me
don't think I
things.
ever hid anything from you about anything.
Right. I think a lot of that has to do with, like you said, who's ready to hear what, right?
Yeah.
Um,
When you're like brand new to the whole thing, when you're younger, you're not going to be ready. But after you've seen a fair amount, like you did over the
right,
years,
right,
it's not too much you haven't seen or heard of.
right, for sure. I think it's important to put a adult side perspective on it. I think it's important for, adult providers to, I don't want to say like cushion things a little bit, but if you have someone that's brand new to this and they're doing everything they're supposed to do, I, I think I think what I'm trying to say is, and I talked to Dr. Bliss a little bit about this, um, sometimes there are providers who, for lack of a better word, they don't really know how to talk to patients, right?
Yeah.
And especially on the adult side, when I went through my hospitalizations and stuff,
Yeah.
I had a provider come in the last time I was hospitalized for a kidney infection and go, not much we can do. This is just gonna kill you one day. And I was like,
That's
okay,
not.
I don't think that's exactly the answer that I'm looking for, right? And I don't think that that's true. And of course, I called you and said, "Hey, this is what's happening." And you said you should probably get an infectious disease doctor in there
Yeah.
that knows what they're talking about and knows
Yeah.
what they're doing. And I said, "Okay." And so I got an infectious disease doctor in, and he was much more he was much better at explaining my situation to me than just
Sometimes people say that when they don't know anything else that they can offer,
right.
but maybe then it's time to see what somebody else can offer.
Right, exactly. And so I think, you know, there's there's a difference between running out of your options
Yeah.
and not knowing what your options are, right?
That's true too.
Yeah. And so I guess all that to say, I want to say that you do a great job at explaining things to people in a way that is not necessarily scary, but is real, right?
Mm,
Um, and not all providers can do that, right?
no.
Um, Especially not that guy that I saw that said I was going to
Yeah.
die. He was. I didn't feel like that was a real scenario for me at that point. I mean, sure, maybe if infections wouldn't have gone down, I would have ran out of antibiotic options. I mean, then maybe that's a very real possibility. But
Yeah.
I still had a couple options, and so
Yeah.
I don't think I'm ready to hear
Yeah.
that.
They kind of jumped the gun on that one.
Yeah,
That wasn't really where you were at.
yeah. So how can patients prepare for appointments to get the most out of them?
Um, know your medicines,
Yeah,
review them.
review them
Um, that's
and know when something's been added too. I
mhm.
think is important. Know when
Yeah.
something's been added because I've noticed on the
Crazy
adult
stuff
side.
happens.
Yeah,
So, um, yeah, know your medicines is probably the most important thing.
for sure. Yeah, I noticed that on the adult side, especially when you go to multiple different systems and stuff.
Yeah.
Because like I'm in Legacy, I'm in Oregon Clinic, and I'm in OHSU. Okay, I'm in three different hospitals, and they don't always communicate.
At least
They don't always-
Legacy and OHSU both share Epic.
Yes, they do, and I know
All right.
Oregon Clinic does too.
Well, that's good.
Yeah.
But a lot of times they don't, and it's really a problem, when you're getting your labs in some place that doesn't share it with Epic, and
Hmm.
um, it really degrades the quality and increases the risk. when things don't show up where they should. I don't know that people really understand that, but to some degree, it's a little dangerous if you're not sharing the same medical record.
Yeah.
So at least all the places that have Epic now, they have that thing called Care Everywhere, where you can see for the most part labs and X-rays and whatnot from the other institution. But um, it's a it's a problem when you're crossing systems a lot.
Yeah. So here's some more young adult and transition focused questions because that's what we're all about with Northwest Kidney
Yeah,
Protection, right?
yeah.
Um, what unique challenges do young adults with kidney disease face when they whether that's when they're transitioning or anything?
Um, well, one is the style of pediatric and adult nephrologist is very different. That probably goes for a number of specialties that you know, adult specialists a lot of times, like if you don't show up or come to your appointment or you know, like forget you, nobody goes chasing after you
Yeah.
to say, hey, you haven't been in a while. So you're kind of like, so it's a very different mindset.
Hmm.
And so it's a bit of a dangerous time because some people aren't prepared for that
Right.
mindset. And if you don't want to take your medicines, they're not going to spend that much time trying to talk you into it. They go, well,
Right.
okay, you made your bed,
You made your
yeah,
choice.
you made your
Yeah.
choice. And so they don't spend a lot of time trying to, you know, convince you. So it's a different mindset. So that transition can be a dangerous time.
Hmm.
Um, just because some people, and you know more about that than I would, but um, it's just people handle you differently. Um,
Hmm.
on so
There's also a lot more options on the adult side. With especially over here when it comes to like nephrology on in pediatrics, you really have Dornbecker and you have
yeah,
Randall.
yeah,
Whereas with nephrology on the adult side, you got Northwest Renal, you got OHSU, you got Peace
yeah,
Health, you
obviously,
got
so,
you got multiple different places to
yeah,
go, and that can be overwhelming.
yeah, can be because it's hard to figure out who's who and um, yeah,
Yeah. Yeah, I know that for me it was hard, but once I found, the group that I wanted to go to, it was like, okay, now I move on to the next person, right? I move on.
yeah,
That's what I kind of liked about OHSU staggering our transition, right?
yeah,
Is that, I aged out of urology first, which
yeah,
kind of I had to go, okay, I got to find a urologist, and then I aged out of nephrology.
yeah,
And it was like, okay, now I can kind of grab
yeah,
you from here and
yeah,
yeah, it's nice when it's staggered. um Unfortunately that doesn't always work for everyone because not everyone is good about getting their appointments scheduled. But I
no,
mean that's just the reality of it, right? And so um
yeah, it's yeah.
yeah.
People can take a few years to make that happen.
Yeah. Well, and on top of that, even for the people listening that might be really good about making appointments, it can take a long time to find someone that's good for you. It took me
Yeah,
years.
yeah, no, it definitely, and you really should keep looking until you find that person.
Yeah,
So you shouldn't just settle.
right.
So
I
that's
certainly didn't.
not a good idea. Not a good idea at all.
Right. Right. I certainly did not settle. I waited. I didn't really wait. I went for it, but I wa- once I had kind of had enough of the place that I was at, I reached out to one of my friends and said, "Hey, who do you recommend?"
Yeah.
because having that community is important, right?
It is. It is important.
And
Yeah,
so I
definitely.
reached out to my community and I said, "What do you guys recommend?" And had someone say, "You should try going to Northwest Renal." And I
Yeah.
said, "Okay, that's where I'm gonna go." And
Yeah.
ever since I started going there and seeing Dr. Hawkins, and I told Dr. Bliss this, and uh, you know, I said as soon as I started seeing Dr. Hawkins, things really turned around, and I felt like I was getting the quality of care that I got from you, Dr. Jenkins.
Did you know that I was a Northwest renal doctor for 1 or 2 years?
You were.
Yeah, I
Well,
think
that
so.
explains why they're so good then.
Yeah, when I moved to Oregon and uh when was it? Or let's see, no. Well, actually, so after I finished my training, I went to, and worked um, in Kentucky for about 9 years.
Hmm.
And when I came back to Oregon, I did it through Northwest Renal for like a year or two, and they actually covered some of the kids. But after a couple of years, and I got busy, they go, "Look, woo, this is too much," and so I took a partner and split off from there.
Hmm.
But yeah, I was Northwest Renal Doc.
That's awesome.
Yeah,
Yeah. No,
yeah,
it's kind of funny that that's where I go now.
yeah,
But yeah, I haven't I've been really happy there. I mean, it's obviously not the same as having you and
yeah.
in all of your amazingness,
And there
but
have been some good people there. I've known a lot of good people there over the years.
oh yeah, for sure. Yeah. Um I can definitely see why a lot of the people I know go there.
Yeah,
I can definitely see why.
yeah,
And I and I've seen a lot of good nephrologists now, and I've seen a lot of mediocre nephrologists, and I've seen some
yeah.
not so great nephrologists, and but
That's true with everything.
yeah, oh yeah.
From plumbers to
Hmm.
whatever, and it's important to figure out who's good and also who works with your personality. So that's important too. So not everybody's going to be the right person for everybody. So
Yeah, for sure. I'm gonna ask one more question, then I'll let you go here. We didn't get to do everything, but I think this is good. Um, I'm gonna be asking every provider this, uh, and it is, what have patients taught you that stays with you?
hmm, hmm.
It's a tough question, I know.
um, well, there's a lot of things that stayed with me. You know, I sort of figure I could learn something from just about anybody.
Mhm.
Um, um, hmm, think of if there's something really special about that. Um, I don't know. I sort of think everybody's different, and everybody's got um, their talents and their things that are good about them. I try to find that in everybody.
Mhm.
Um, 'Cause, most everybody I've ever dealt with, I put them in the good column. I don't think I've had too many dirty rats over the years.
Right.
Um, so I guess that everybody's an individual. They're not they're not a disease or a cookie cutter. You can't treat everybody the same with everything.
Mhm.
And everybody, you got to individualize everything for everybody. There's not just like a cookbook to
Mhm.
give to people.
Right.
Everybody's their own person and like to get to know who they are and individualize things for them. um, not just the recommendations or whatever. So it's been fun to see so many different people, and
Mhm.
because nobody's alike,
Yeah.
everybody's unique,
Mhm.
um, and that's kind of cool. Actually, it's kind of cool. I feel privileged to have known so many people, and when you see people a lot, you get to know a lot about them,
Mhm.
and it's kind of a special relationship you get to have with a lot of people that other people don't get. A lot of jobs, everything you're more peripheral from a lot of people. You don't really get into the nitty gritty and strong emotions, and so I sort of feel privileged to have gotten to know a lot of people kind of at a deeper level,
Mhm.
and but I guess I'd say that everybody's different.
Yeah.
Everybody has different needs, and expectations, and it's kind of a fun thing trying to figure out what it's going to take to work for that person,
Mhm.
and it's all individualized.
Yeah, for sure. Well, thank you so much for taking time out of your day. I know it's late for you over on the East Coast.
It kind of is.
But I really appreciate you coming and taking your time to do this.
Yeah.
If people like this interview enough, maybe we'll do a part two and do the stuff that we didn't cover.
All right. Sounds
All
good.
right. All right.
All right. Nice talking to
Well,
you,
it
Dakota.
was good talking to you.
All right.
All
You
right.
take care.
See you. You too.
Bye.